Bismillahirrahmanirrahim. Assalamu alaikum. Today we will discuss hip bone. The mature hip bone is the large flat pelvic bone which is formed by the fusion of three primary bones. The bone above is called as ilium, and the bone which is thin and anterior is called as pubis, and the bone which is thick and posterior is called as ischium. Hip bone word is derived from a Latin word os coxae. So we have three primary bones, ilium, pubis and ischium. Each of these three bones is formed by its own primary center of ossification. See here, this is the primary center of ossification for ilium, this is for pubis, and this is for ischium. They are shown in red circle. And there are 5 secondary centers of ossification which will appear later, which are shown by the pink circle. At birth, the three primary bones, they are joined by the hyaline cartilage. In children, they are incompletely ossified. At puberty, the three bones are still separated by a Y-shaped triradiate cartilage which is centered in the acetabulum. See here, this is a structure which is called as acetabulum. And in the center of the acetabulum, we have a Y-shaped cartilage which is called as triradiate cartilage. Okay, which is the fusion of three bones. Okay, so this is triradiate cartilage. Then we have one ischiopubic ramus. See here, we have two rami of the pubis. One is called as superior pubic ramus and one is inferior pubic ramus, and we have one ramus for the ischium. The inferior pubic ramus and the ramus of the ischium, they will join together to form the ischiopubic ramus at the 9th year. It will fuse at the age of 9. This is very important, that the ischiopubic ramus will fuse at the age of 9. The bones begin to fuse between 15 and 17 years of age. Fusion is complete between 20 and 25 years of age. Little or no trace of lines of fusion of the primary bone is visible in the old adult. Okay, so there will be no trace of the line of fusion. See in this diagram again the bones, this is ilium, then we have pubis, then we have ischium. Ilium is a thin bone, it is present superiorly. Pubis is also thin, it is present anteriorly, and we have a thick bone which is ischium, which is present posteriorly. See here, how will you know that which one is anterior side and which one is posterior side? On the anterior side we have pubis, on the posterior side we have ischium, and we have a greater sciatic notch on the posterior side. So remember this notch, can you see this deep notch? This is greater sciatic notch, greater sciatic notch, this one. Okay, so it will show that this side is posterior side and the other side where the pubis is present, it is anterior side. See this diagram, this is ilium. They have shown the medial surface of the ilium here, and the pubis and the ischium, this is medial surface. Okay, medial surface, this is ilium, then we have the pubis and we have the ischium. Now we will discuss all these three bones one by one. First of all, ilium. See here, the ilium forms the largest part of the hip bone and it contributes the superior part of the acetabulum. What is acetabulum? Acetabulum is a cup-shaped fossa present on the hip bone on the lateral surface, and it will articulate with the head of the femur to form the hip joint. This acetabulum is formed by the fusion of three bones. One is ilium, one is pubis, and one is ischium. Okay, so this is pubis, this is ischium, and this above one is ilium. So this ilium will form the superior part of the acetabulum. The ilium will have one lateral surface and one medial surface. See here, this is the medial surface of the ilium. The ilium has thick medial portions. Can you see thick medial portions here, or the columns for the weight bearing? This is medial surface, and on the lateral surface it has ala, or the wing of the ilium. This is called as wing of the ilium, that provide broad surface for the fleshy attachment of the muscles. The body of the ilium join the pubis. Okay, it is joining the pubis and ischium to form the acetabulum. This is body of ilium. Body of ilium. Anteriorly, we have two spines on the ilium. One is called as anterior superior iliac spine, and the below one is called as anterior inferior iliac spine. Why they are named as anterior? Because they are present on the anterior side. One is superior, one is inferior. Both are iliac because they are present on the ilium, and they are spines. So they are named as anterior superior iliac spine and anterior inferior iliac spine. Okay, we have discussed the body of the ilium and two spines, which are anterior superior and anterior inferior iliac spine. There are some other features also. We have discussed anterior superior iliac spine. Then we have the iliac crest. This is long, curved and thickened superior border of the ala or the wing of the ilium. This is called as iliac crest. Then we have posterior superior iliac spine. See here on the posterior side, we have two spines. One is superior, one is inferior. The superior one is called as posterior superior iliac spine, and the below one is called as posterior inferior iliac spine, okay, which will mark the superior end of the greater sciatic notch. This is very, very important. See here, this is greater sciatic notch, and the spine which is over the superior boundary of the greater sciatic notch is called as posterior inferior iliac spine. Then we have the tubercle of the iliac crest, okay. It is present on the external lip of the crest, as there are two lips. One is outer lip of the iliac crest or the external lip, and one is internal lip of the iliac crest or the inner lip. So the tubercle is present on the outer lip or the external lip of the iliac crest. This tubercle is about 5 to 6 centimeters behind the anterior superior iliac spine. So what features we have discussed in this slide? We have discussed anterior superior iliac spine, then we have anterior inferior iliac spine, we have iliac crest, then we have posterior superior iliac spine and posterior inferior iliac spine, and we have the tubercle of the iliac crest, which is also called as iliac tubercle. Now we will discuss the lateral surface. Okay, this is the lateral surface of the hip bone. How we come to know that this is lateral surface? Because lateral surface has the acetabulum. This is acetabulum which is present on the lateral surface of the hip bone or the lateral surface of the ilium. Okay, so the lateral surface of the ala of the ilium has three curved lines. Can you see these three curved lines? Okay, this is the posterior. These are named as gluteal lines. Okay, gluteal lines. See here, this is posterior gluteal line, this is middle gluteal line or the anterior gluteal line, and the below one is called as inferior gluteal line. Okay, they are demarking the proximal attachment of the three large gluteal muscles of the gluteal region. One is gluteus maximus muscle, one is gluteus medius muscle, and one is gluteus minimus muscle. Okay, so they are present on the lateral surface of the hip bone. Okay, so this is the lateral surface. On the medial surface, see here, we have the wing or the ala of the ilium, which will provide attachment for the iliacus muscle. The muscle which is shown here is called as iliacus muscle. Why it is called as iliacus? Because it is attached to the ilium, or it has its proximal attachment with the ilium. Okay, the bone forming the superior part of the fossa, this fossa, the iliac fossa, become thin and translucent, especially in the older woman with the osteoporosis. So what we have learned here, on the lateral surface of the ilium, we have the wing or the ala. These wings or ala, they have three gluteal lines. One is posterior gluteal line, one is middle gluteal line, and one is inferior gluteal line. On the medial surface, there is iliac fossa, which is giving attachment to the iliacus muscle. See here, it is giving attachment to the iliacus muscle. This is the medial surface of the ilium. Now, posteriorly, the medial surface. See here, this is the anterior part of the medial surface, and this is the posterior part of the medial surface. How we have come to know? See here, there is greater sciatic notch on the posterior side. This is greater sciatic notch, and ischium, which is present posteriorly, and this is pubis, which is anterior. So this is anterior side, and the other one is posterior side. But this surface is medial surface. Medial medial surface. So the medial aspect of the ilium has a rough ear shaped. Can you see here? This is a rough ear shaped articular area called as auricular surface. Why it is called as auricular? Because auricula means a little ear. This is ear shaped, so it is called as the auricular surface. And we have the rough tuberosity, which is called as the iliac tuberosity, which is superior to the auricular surface. And this iliac tuberosity is for the attachment with the reciprocal surfaces of the sacrum to form the sacroiliac joint. These things are very, very important. In exam, they will come in viva, they will come in OSCE. Okay, you will be asked that where is anterior superior iliac spine, where is anterior inferior iliac spine, where is iliac crest, where is iliac fossa. This is iliac fossa, which is giving attachment to the iliacus muscle. This is auricular surface, which is because of the little ear shaped. Then we have the iliac tuberosity, which is forming the sacroiliac joint. We have iliac crest having the tubercle, which is called as iliac tubercle. Then we have the greater sciatic notch. See here, this is greater sciatic notch, and there is a posterior inferior iliac spine and posterior superior iliac spine. Okay, then there will be another structures also. So we have learned all these features here. This was ilium. Now we will discuss the ischium. See here, ischium. This is ischium. The ischium forms the posterior inferior part of the hip bone. Again I will tell you, see here, this is ischium. This is present posteriorly and inferiorly. The superior part of the body of the ischium fuse with the pubis. See here, it is fusing with the pubis and the ilium, forming the posterior inferior aspect of the acetabulum. See here, this is acetabulum. The posterior inferior aspect of the acetabulum is formed by the ischium. The ramus of the ischium. Now we will discuss the ramus of ischium. See here, there is one ramus. Okay, it will join the inferior pubic ramus to form the ischiopubis. Why it is called as ischiopubis? Because it is formed by ischium and pubis. This ischiopubic ramus will constitute the inferior medial boundary of the obturator foramen. See here, I have told you this foramen is called as obturator foramen. So this ischiopubic ramus or the ischial ramus is forming the inferior medial boundary of the obturator foramen. Now the posterior border of the ischium forms the inferior margin of the deep indentation. See here, this is greater sciatic notch. I have told you greater sciatic notch will be present on the posterior part, and it is above the ischium. This is ischium, and above it there is a greater sciatic notch, and there is a small notch also, which is called as lesser sciatic notch. In between the two notches there is a spine, which is a thin spine, which is called as ischial spine, and the greater sciatic notch will have a spine on its superior boundary, which is called as posterior inferior iliac spine, because it is on the posterior side, but it is inferior because there is one superior iliac spine also, and it is of ilium, so it is called as iliac spine. So what we have discussed here, this is posterior inferior iliac spine, then we have greater sciatic notch, then we have ischial spine, then we have lesser sciatic notch, and this is ischial. Now there will be ischial tuberosity. See here, this is a big rough area which is called as ischial tuberosity. This is called as the body of the ischium, okay, which is forming the part of the acetabulum, and there is the ramus of the ischium. This ramus is forming the inferior medial boundary of the obturator foramen. So this is obturator foramen. The large triangular ischial spine at the inferior margin of the greater sciatic notch will provide the ligamentous attachment. See here, this is ischial spine, okay? It is present at the lower margin of the greater sciatic notch. This sharp demarcation separates the greater sciatic notch from the more inferior, small, rounded and smooth surface indentation called as the lesser sciatic notch. So this ischial spine is in between the greater sciatic notch and the lesser sciatic notch. The rough bony projection at the junction of the inferior end of the body of the ischium and its ramus. See here, this is body of ischium and this is the ramus of ischium. So there is a rough bony projection which is called as ischial tuberosity. So this is called as ischial tuberosity. So these were the features of the ischium. Now we will discuss the pubis. See here, this is pubis. Pubis forms the anterior medial part of the hip bone, contributing the anterior part of the acetabulum also. Okay, and it provides proximal attachment for the muscles of the medial thigh. Okay, so it will give attachment to the muscles of the medial compartment of the thigh. The pubis is divided into flattened medially placed body. See here, there is a medially placed body and there is a superior pubic ramus and there is the inferior pubic ramus. Okay, superior pubic ramus and inferior pubic ramus. Medially, the symphysial surface of the body of the pubis articulate with the corresponding surface of the body of the pubis. See here in this diagram, this is the body of the pubis and there is another body of the pubis on the other side. The two bodies of the pubis have these surfaces which are called as symphysial surface, and they will form a joint which is secondary cartilaginous joint. This is pubic symphysis. Symphysis is the secondary cartilaginous joint. So they have formed pubic symphysis. Now the anterior superior body of the united bodies and the symphysis form a pubic crest. See here, there will be a pubic crest here which will provide attachment for the abdominal muscles. So what we have discussed in the pubis, there is a body of the pubis which has the pubic symphysis. Then there are two rami, one is superior pubic ramus and one is inferior pubic ramus, which will articulate with the ischial ramus to form the ischiopubic rami or ischiopubic ramus. Some projections at the lateral end of this crest. See here, on the pubis we have the pubic crest. So there is a big pubic tubercle. See here, this is a pubic tubercle which is important landmark for the inguinal region. This is pubic tubercle. This pubic tubercle will provide attachment for the main part of the inguinal ligament. Okay, it is present on the lateral end of the pubic crest. This is pubic tubercle. Now, what is obturator foramen? See here, this is obturator foramen. It is a large oval or irregularly triangular opening in the hip bone. It is bounded by the pubis. See here, it is bounded by pubis and ischium and their rami. Except for a small passage. See here in this diagram, there is a small passage which is called as obturator canal. Okay, this passage is for the obturator nerve and obturator vessels. This obturator foramen, it is closed by a thin, strong obturator membrane. So only the obturator canal will be opened, but whole of the obturator foramen will be closed by the obturator membrane. Okay, so this is obturator foramen having the obturator canal, and this is obturator membrane. Now, acetabulum. See here, this is acetabulum. Acetabulum is a Latin word which means shallow vinegar cup. It is a large cup-shaped cavity or a socket on the lateral aspect of the hip bone that articulates with the head of the femur to form the hip joint. All three bones, they will unite together and they will contribute in the formation of the acetabulum. The margins of acetabulum is incomplete inferiorly. See here, it is incomplete inferiorly at the acetabular notch. This is called as acetabular notch. The rough depression. Can you see a rough depression here in the acetabulum, in the floor of the acetabulum? It is extending superiorly from the acetabular notch, is called as acetabular fossa. This is called as acetabular fossa. The acetabular notch and the acetabular fossa, they also create a deficit in the smooth lunate surface of the acetabulum, the articular surface receiving the head of the femur. So this is acetabular notch and this is called as acetabular fossa. Now, how will you know that what is the anatomical position of the hip bone? The anterior superior iliac spine and the anterior superior aspect of the pubis, okay, the pubis should be in the same coronal plane. They should be in the same coronal plane. The symphysial surface of the pubis is vertical and it is parallel to the median plane. The acetabulum faces inferior laterally. See here, the acetabulum should be on the lateral side of the hip bone with the acetabular notch directed inferiorly. See, in the previous diagram, the acetabular notch will be placed inferiorly. Okay, then the obturator foramen lies inferior medial to the acetabulum. See here, this is more visible on the medial surface. Then the internal aspect of the body of the pubis faces almost directly superiorly. It forms the inner surface. Okay, the internal aspect of the body of the pubis will form a floor on which the urinary bladder rests. So this was hip bone. I will discuss some of the muscles which are attached on the hip bone. See here, this is the lateral surface of the hip bone. First of all, I will tell you some of the features of the hip bone. See here, this is posterior side. Why this is posterior side? Because here there is greater sciatic notch. Why this is lateral surface? Because on the lateral surface we have acetabulum and this is anterior surface. So what are the features? This is anterior superior iliac spine. This is anterior inferior iliac spine. We have the iliac crest. There are two lips of the iliac crest. One is inner lip and one is outer lip. There is tubercle on the outer lip of the iliac crest, which is called as iliac tubercle. We have posterior superior iliac spine. We have posterior inferior iliac spine. We have the greater sciatic notch here. So these were the parts of the ilium. This is lateral surface. Lateral surface will have the ala or the wings of the ilium having three gluteal lines. This is posterior gluteal line. This is anterior or middle gluteal line, and there is inferior gluteal line. Okay. Then we will come toward acetabulum. This is acetabulum having the acetabular fossa and the acetabular notch. Then we have the ischium. See here, this is ischium or the body of the ischium first. We have the greater sciatic notch. We have ischial spine. Then we have the lesser sciatic notch. Then we have ischial tuberosity and the ischial ramus. This was the ischium. Then we have obturator foramen. See here, this is obturator foramen. And on the pubis, we have the body of the pubis, the superior pubic ramus, the inferior pubic ramus, and we have the pubic tubercle, which will give attachment to the inguinal ligament. Okay, so what are the structures which are attached here? See here, on the wing or the ala of the ilium, we have three gluteal muscles which are attached. One is gluteus maximus muscle. This is gluteus maximus. Then we have the gluteus medius muscle, and then we will have the gluteus minimus muscle. This is gluteus minimus. Okay, these muscles, they are of the gluteal region of the thigh or the back of the thigh or the gluteal part, okay, or the hip region. Then we have the tensor fascia lata. This is tensor fascia lata, which will form the iliotibial tract. Okay, so this is also attached here on the lateral surface of the ilium. Then we have the inguinal ligament, which is attached on the anterior superior iliac spine. Okay, then on the anterior part on the ilium, we have the muscles attached, which are the muscles of the anterior compartment of the thigh. This is sartorius muscle. See here, this is sartorius muscle, which will be a ribbon-like muscle or the Taylor's muscle, which we will discuss in the anterior compartment of thigh. And we have the rectus femoris muscle. See here, there are two heads of the rectus femoris muscle, which is also the muscle of the anterior compartment of thigh, which is attached, the straight head and the reflected head. The straight head is attached on the anterior inferior iliac spine, and there is the reflected head of the rectus femoris muscle, which is attached just above the acetabulum. Okay, we will come here on the posterior side, below the posterior superior iliac spine and up till the posterior inferior iliac spine. We have the attachment of the sacrotuberous ligament. This is sacrotuberous ligament. Then this is greater sciatic notch. Then on the ischial spine, there is attachment for the sacrospinous ligament. This is sacrospinous ligament attachment. Then on the lesser sciatic notch, there are muscles which are attached, which is called as gemellus superior and gemellus inferior muscle. Gemellus superior and gemellus inferior muscle. Then on the ischial tuberosity and the body of the ischium, we have semimembranosus, semitendinosus, biceps femoris muscle. These three muscles are the muscles of the back of the thigh. Back of the thigh. Okay. Then we have the quadratus femoris muscle also, which is attached here above the obturator foramen. Then we have the adductor magnus. Can you see here? The adductor magnus muscle is present here. This is the muscle of the medial compartment of the thigh. This is present, or it is attached to the ischial ramus and the ischiopubic ramus. Then we have the muscles of the medial compartment of the thigh, which are obturator externus muscle, gracilis muscle, adductor brevis and adductor longus muscle, and pectineus. These muscles are attached on the pubis. So pubis will give attachment to the muscles of the medial compartment of thigh. So remember all these muscles. Okay, we will discuss all these muscles one by one in the specific compartment. There are three compartments of the thigh. One is anterior compartment of thigh, one is medial compartment of thigh, and one is posterior compartment of thigh, which is also called as the back of thigh. So we will discuss all these muscles, but in this presentation you should know what are the features of the hip bone. Okay, if you know the features of hip bone, then automatically you will understand and you will recognize the feature and you will learn the attachment of the muscle. Okay, that this muscle was attached or this muscle was present on that feature. Okay, so you should know the features of the hip bone. See, this is another surface of the another view of the hip bone. Okay, it is the muscles, they have shown attachment on the external surface. Again, this is gluteus maximus, this is gluteus medius and gluteus minimus. Tensor fascia lata, sartorius is present on the anterior superior iliac spine. Then rectus femoris, the reflected head and the straight head on the anterior inferior iliac spine. Then we have gemellus superior inferior on the ischial spine. Then we have semitendinosus, semimembranosus and semitendinosus and biceps femoris muscle, the muscles of the back of the thigh on the ischial side. Then we have again on the pubis we have muscles of the medial compartment of thigh. So remember all these features. I hope that you have learned each and everything of the hip bone. Thank you very much.